Hello, everybody. This is Larry Johnson, founder of the Eight Principles, for another edition of Eight Principles Voices. And today I have a really unusual guy, and that's a positive thing with me. His name is Jason Paltzer, and he's the executive director of something called the Meros Center. Did I get that right, Jason?
That's correct, Larry.
Well, what he does really got my attention when he's exploring the interface between spirituality and health, the physical, the spiritual. And we're not talking about witch doctors and hocus pocus here. We're talking about something far more grounded and more thoughtful. And so I knew I had to have him on the show. So thank you for coming, Jason.
Thank you for having me, Larry. It's a pleasure to be here.
So before we get into the meat of it, tell me a little bit about, or tell our audience a little bit about your background. How does someone get to do what you're doing?
Yeah, it's designed by God. Um, I love Jesus and really uh, just had a desire to see him in the world and uh, how his grace influences community. And that led me into the space of public health. And so after I went through my public health training, I knew I wanted to get into missions. And so I spent some time in Zambia working alongside the Lutheran Church there and really got into this thing of community health ministry, which is just what you said. How are we taking who we are as God designed us and using it to live in healthy communities that flourish, that live as God designed, that live with dignity and justice as He wants us to. Um, and so I started to do this work in churches, but at the same time started to come up with questions about what we know from public health seems to just scratch the surface of really who we are as individuals and who we are as humans and how that should inform our programs and our interventions and how we understand the connections between people. A particular issue really caught my attention, and that was substance use. In rural Zambia, where I didn't think that would be much of an issue, and it was really crippling a lot of our work. Um, Without having answers to some of my questions, that led me into the space of research. And how can we better understand what we're seeing in these communities with a process that is rigor enough to speak into the secular space? I got my PhD in population health sciences with that idea. I spent some time in academia at Grand Canyon University and Baylor University, and quickly realized that the research I wanted to do was really going to be research driven by the organizations, not by the academy. And a few years ago, that led to conversations, which ultimately led to the start of the Meros Center, which is this Christian research center.
Now, if I understand it correctly, the Meros Center serves as sort of an umbrella for a lot of other smaller organizations. Tell me a little bit about that.
Yeah, that's right. And so in my experience, I was seeing some really neat things happening among these smaller organizations. There are hundreds of thousands of these community-based organizations, many of them faith-based, and really looking to have a more holistic approach to their health programming. So as we worked with them and we studied them, we studied over 100, and we saw that over 70% of them wanted a place to measure and disseminate their impacts. They wanted a place where they could learn from each other about what they're doing because they were doing some pretty innovative things, um, very similar to the bright spots idea um, by in Vietnam where they were studying the nutrition. And I was like, how do we amplify that kind of knowledge within this space of Christian health ministry, and how can we give those organizations access to the research design, the research methods, and then the dissemination through pathways like peer-reviewed publication that have the credibility to speak into this broader space?
So, I know you gave me an example once, and it doesn't have to be the same one, but a concrete example where spirituality will impact actual protocols of treatment. And could you give me an example of that?
Yeah, so one example in one organizations we've been working with is called Resilient Recovery, and they are a faith-based recovery program here in Phoenix. And as part of a faith-based recovery program, a key emphasis is forgiveness. How do individuals experience forgiveness as they're going through the recovery process, as it strengthens their place of abstinence? And so we helped Resilience study that. We studied um, substance use and individuals' perceptions of forgiveness as they were going through resilient recovery. And what we found was that, yes, there was some movement, but not as much as expected during at least the 6 weeks that we studied the program. And so that caused us to work with the program director and kind of rethink, like, are we having the right components within the model? Are there experiences that we need to understand better in order to better communicate the law gospel within the program itself? Not that we're changing God's word, but we are thinking, how can we better communicate, connect with people that are working through the program?
And then what was the outcome of that?
That led to another study. So now we are working on what's called the Stay in Touch project, because we realized that we do want to extend the length of time that people are in the program. And so that led to a 12-month study of, can we connect with them in moments outside of the program? They come for 1 hour a week, but if we stay in touch with them throughout the week, or like just send them a simple text message, will that prompt them to think differently about the recovery journey and stay involved with the process?
Mm.
So that was one way we wanted to just get them into thinking about the content beyond just being there for that 1 hour. And we thought maybe that would change and strengthen the individual's experience of forgiveness, for example.
Right. So I believe when we talked earlier, you mentioned something about um, using spiritual components in lieu of pharmaceuticals. Um, there was something regarding that. Do you remember what we talked about?
I don't remember the exact um, example, but we do have one project where, not necessarily in lieu of, but we are working on a project where we're looking at naltrexone for addiction and how that medication assisted treatment, um, is it effective within, and is it more effective within a context of faith support?
Okay.
And what are those characteristics? If someone is taking a product like naltrexone for alcohol addiction, is there a greater um, effectiveness when they have that faith support, the permission, the social support, and the beliefs that lead to then more religious coping to almost be a foundation for that kind of treatment?
So, and what does that particular drug do? What's the operating mechanics of that? What is it supposed to do?
Yeah. So naltrexone, I believe, is something that prevents alcohol from having that sort of pleasurable effect. So even if you are to drink alcohol while on naltrexone, you do not receive the pleasures that would normally come from drinking, and so it decreases that sort of pathway between drinking alcohol and the pleasurable effects of it. Um, and therefore, the idea is that as you do that over time, you ultimately lose the desire for drinking alcohol altogether,
I see.
because it kind of disrupts that pathway.
Do you still become intoxicated?
Um, the Yes, however, um, the intoxication then doesn't, it's not associated with all the pleasure that also comes with it. So then
You're just out of control drunk. In other words, you still get your motor and all that stuff is done. Okay. All right.
yeah.
Well, this is, I'm just, uh, can you just take a minute or two to name the different organizations that you're working with as a part of this umbrella and describe for me or for our audience what each one of these is exploring?
Yeah. So one organization we're working with is Medical Ambassadors International. Medical Ambassadors International has been around, I believe, since the 70s, or at least the strategy that they're using has been around since the 70s. That strategy is community health evangelism. And even though it's been around a long time, the overall evidence of how it's transforming communities, both physically and spiritually, is minimal. There's maybe been a couple of studies in these last decades really looking at the impact. So we're working with them on a project that is to develop a rapid impact assessment. How can we have more community-based assessment of the impact, both physically and spiritually, of community health evangelism in a way that we can then better understand, is the current strategy working as we thought? A lot of this, Larry, gets at helping organizations test their existing assumptions about a particular program that maybe they have done for, in this case, decades, but really wondering, is the training process we are using, is it developing the people doing the things that we expect them to do,
I see.
leading to the impacts that we think are coming? And what a lot of organizations will do is they'll look at the outliers, they'll look at the tails of the distribution and say, oh yes, it's working or it's not working, without really looking at the middle of the bell curve and seeing what's happening for the rest
Yes.
of the group in the middle. And that's what we're really helping medical ambassadors do, both on the, looking at some of those spiritual indicators of um, how well do people perceive their faith influencing their health. Does that really translate to health behaviors? Now, a challenge with this is that you still want to control for other factors in the community that might be influencing health behavior, right? Is there a health clinic that's available that's also doing some kind of health education, for example? So you look at these issues of confounding as we start to move toward establishing causal mechanisms for how faith is really foundational in terms of promoting um, positive health behaviors and health outcomes. So that's one pretty large project because it spans multiple countries, and it's a strategy that's been around for a while. But then we have another smaller partnership in El Salvador, and this is a program called Counteract, and they're working with imprisoned youth. And they're working with youth going through life skills, Christian discipleship, and they're helping youth get a restart after they've spent years, in gang life and some pretty hard situations. Um, and they're seeing great success. And now they're asking what part of this program is leading to some of those successes. Like, are some parts more impactful than others? So we're going to help them look at that, look at their program, and do an assessment of some of the kids, and study before and after in terms of, are there certain components of their program that they should amplify, and maybe some that they could minimize in order to maybe speed up the process. So instead of having it be a year, maybe it's 6 months. But those are some of the questions that they're asking as an organization. Um, we're working with another organization called Kingdom Workers here in the US, and they have a disability ministry called Jesus Cares. And in the past, um, the programming would separate out individuals with disabilities and their families from the rest of church life. And we know that just being part and attending worship um, leads to up to a 30% reduction in premature mortality.
Oh,
Just going to church, worship attendance. Now, there's the whole question of what's the mechanism between that and the reduction in premature mortality. So, with some of this evidence, we're working with this disability ministry, and the idea is does a what kind of ministry best leads to congregational health, right? And how is it a more inclusive program that can then lead to that kind of congregational health? Jesus Cares typically is not, where they're worshiping as a separate group. So we're doing a qualitative study to kind of get at um, what are some of the perceptions of that? Are they really improving um, health for just a few, or is it impacting the congregational health as an entire entity? The idea there is then we will provide recommendations to changing the Jesus Cares ministry based on the evidence, and possibly having a more inclusive program versus just a more separate one.
You know,
Ultimately, it gets at belonging.
I'm just listening to this and I'm thinking, getting measurements of effectiveness is a perennial subject in nonprofits. Is our work actually working? And here you are, you're taking what I would consider a pretty esoteric project and you're demonstrating that you can do it, do it well. Um, what's your background? I know you said it was public health. Is that what you said your background was in?
Yeah, I was in public health practice for about 6 years. Then I got into research with my PhD in population health sciences. Um, so I was in research for a while. And so research, public health, and missions.
So,
That's the three pieces that come together.
do you have statisticians working for you?
Mhm,
Mathematicians? Yeah.
mhm.
All right. Um, did they do any?
Yeah, and
Go ahead.
in fact, our research scientist that we just brought on, she's um, 2 degrees in statistics and has done a couple of postdocs. Her area of focus is Alzheimer's and dementia research. And that's another area that we are now getting into as it's a global concern and it's just going to get more of a platform as our population ages. That's one of the emerging trends that we're seeing globally.
Yeah. I'm just kind of fascinated by this. So, do they do any really sophisticated things like curve fitting models and higher order kinds of things? Or I know I'm not making much sense, but I think you know what I'm talking about.
Yeah, so I mean, the idea to get more rigorous in the statistical analysis and move towards causality is the goal. And that's where relationships come in. Our relationship with these organizations is key, that it's not just a contract or a consulting relationship, but oftentimes we have to start with a more qualitative exploratory project so that we can just help them understand what their story is and ultimately move toward being a better steward of the resources they've given. Once we understand more qualitatively how they're defining concepts and determinants within their own context, we can then help them develop hypotheses that move towards testing. And God willing, we start moving toward more longitudinal studies
Yeah.
so we can study and follow and track people over years. This is a big gap in this area of research of faith and health. Um, one of the studies happening now is called the Global Flourishing Study between Harvard and Baylor. And this is one of the first longitudinal studies that's going to be happening among 22 countries, over 200,000 people.
Wow.
And we've been fortunate enough to have a role within this study, looking at a couple of the topics. So that's been a blessing to be a part of and hopefully bring in some of these concepts into our own longitudinal studies. We want to think differently about how to fund them as well. That, coming from the philanthropy space, Larry, grants are short term. Even if they're 3 to 5 years,
Sure.
they're short term and they're restricted, right? And so how do we think differently about possibly endowing not just researchers, but studies themselves,
Mhm.
or having longer term funding so that we can measure 10 plus years of a particular issue over multiple countries? So we can start to see themes that are cross-cutting culturally and geographically and still give us some good insight that we can share among the organizations we're working with. Right now, we have about 15 different organizations we're working with on about 18 different projects. So,
So, how do you pay for all this? I mean, you mentioned grants. And
yeah.
we know the ups and downs of those. They
Mhm.
can be very specific, short term, generally not renewable. Um, what's your funding based? Where do you go to request funds?
Yeah, in some cases, the organizations themselves will include us as a sub-grantee on the project to help with the research or fund out of their own budget the project. We're able to bring down the cost of research because of our use of volunteer research scholars. We have about 38 research scholars that have a desire to do this kind of research. They have appointments at their universities, our institutions, but they're very interested in helping organizations develop this. So that allows us to kind of bring down the cost of the researcher themselves. And then we use students. So at any point in time, we have 8 to 9 graduate students or undergraduate students helping us with projects on data collection or doing interviews, things like that. And then we get the organization involved themselves. That's where the word Meros comes from. Meros comes from 1 Corinthians 12 that says, "You are a part of the body of Christ. You are the body of Christ, and each of you is a part of it." And we take that practically into the research space where we involve others so that the data can be owned locally, can be owned by the organization, and put the organization in the driver's seat in terms of the question that's being asked. And that's how we try and do it in a way that's efficient and economical for them and then for us as well.
Now, these are all separate incorporated 501c3s, correct?
That's
Um,
correct.
Tell me about your governing board. Is it made up of members of the other boards, or how's it set up?
So right now we have a management committee. We are moving toward our registration as 501c3 status. Early next year, we'll have that registration. We are currently a joint venture between Wisconsin Lutheran College and Kingdom Workers. So Wisconsin Lutheran College is our academic home. That's where we go for our ethics review, where we have our courses up on their platform. So our management committee is made up of members of those two organizations. As we move toward a board, that's the idea, is to bring on folks that understand the research process, but also understand the mission partnership space, the organization space, the financing space, and really have a diverse board that recognizes, kind of this connection and this impact network that we're trying to create.
So, how many people are on your governing board right now?
So right now there's 5 on our management committee, and then we will transition into a board next year. We will probably start out with 7 or 8 on our board.
And the reason for that is,
The size of it,
well, as I understand it, you're still moving toward final acceptance
correct,
C3 status, correct?
correct.
All right.
Yeah.
So now maybe you said this and it blew past me, but how long have you been doing this?
So I finished my public health degree in 2003. So
Okay.
I've been working at this for more than 20 years. The idea of this kind of research center first was kind of birthed in about 2011 as I was finishing my PhD and just really thinking, how am I going to use this skill of a researcher to really move missions forward? When I was working in missions, Larry, I just saw a need to do it differently. The way that we were merely just we were teaching, but we weren't really transferring the ownership and the empowerment of what does it mean to live as God designed us to, with Jesus at his love at the center for us. And I was thinking of these participatory approaches, community ownership. How are we taking these principles and influencing the way we do health missions? And that's really what drove me to want to change that. And how do we do it differently? How do we do it better? As the global population grows, we are also seeing a bigger disparity in terms of um, people that know Jesus. And I think there's an opportunity for us to understand better how God designed us, how He truly designed us to live in this world and to flourish under His kingdom and in His grace.
Um, you're familiar with Jordan Peterson, I'm sure.
Yeah, yeah.
Um, how does any of his work overlap with yours?
His level of curiosity and his desire to understand biblical truth in terms of how we relate to each other, how we
Mhm.
relate as a society, I think it's the core, in terms of, and I believe that's his focus, is trying to understand that
Yeah.
and to pull out. And then for us, it's how do we pull out the practice piece? Not only understanding, but then what does that mean for practice? What does that mean for individuals that are going through recovery to have a better sense of forgiveness, not only from God, but then with each other, right?
Yeah.
So that's kind of the next step then is taking that knowledge and that space of curiosity and discovery and translating it, interpreting it for people that are actually developing programs.
Yeah. I'm just curious about that. Um, so then, how many overall organizations are you representing? Are you that's under the umbrella? How many are there?
Right now, we're working with about 15 different
15.
organizations.
15.
Hmm.
And we've talked about what, one or two,
Yeah, a
maybe.
few.
Um, uh, Pick one out of the hat and that you think is really kind of out there. And let's talk about that for 5 minutes.
I mean, I think the organization in El Salvador is really interesting, but I think um, I don't know if any of them are really out there, Larry, in terms of just doing something that is off the wall. But I think like the local church, like the Lutheran church in Malawi, for example. I'm gonna talk about that for a second. It's a smaller denomination in Malawi. There's a sister denomination in Zambia. And we were able to work with a few of their pastors. And their pastors went through our training in community health ministry. And after they got through the training, the pastors in Zambia just started to ask the question of mental health among youth because they were seeing it in their churches. But after understanding better the integration of the physical and the spiritual, they were just convicted. They're like, we need to do something, and to help our churches uh, um, not only approach, not only teach, but to walk alongside our youth that are struggling with
Yeah.
mental health. And so we get to walk with them from the initial ideation stage and help them design a simple workshop to gather awareness. And now we're going to help them do focus groups with youth in both Zambia and Malawi to understand really what is happening among the youth there. And we get to work with a professor at Marquette University, Stephen Saunders, who spent his career studying mental health and mental health in the church. He developed a program called the Friendship Ministry. And now we get to work with him and he gets to test his theory and his program in Central Africa. And so we're able to combine an idea in the field with a generated program in the academy
Okay.
and possibly do something different for a group of churches that are passionate about serving their youth and the mental health of their youth in countries where mental health services are very, very low. And now the church can play a key role using some of the best evidence that we're able to help them connect.
You know, I see the power of what you're doing. I see the need. I even see the impact. When you start to, well, you already are, but I mean, you're raising funds.
Mhm.
Some of it comes from individuals.
Mhm.
Some of it comes. It's a pretty esoteric subject, Jason.
Yes.
So, if I'm Joe Blow donor out here, and I'm inclined to support you, but I don't know much about you. I mean, how would you sell it to me? I mean, how would you present it in a way that my eyes just wouldn't cross about 2 minutes in?
That's a wonderful question. It's something that I've learned a lot and continue to learn how to do in terms of what's the communication of this message. Because as soon as we start talking about research, like you said, it's like, mm, yeah, whose lives are being changed? That's what we want to know. And yes, down the road, lives are being changed. Um, but how do we tell the message that we are empowering organizations to not only increase their impact, but
Yeah,
their credibility in the community, their credibility with donors, their credibility with government. And that's the power. So being able to tell that story, it's a story of stewardship. It's a story of missions, and especially working with people that are religious. I mean, as you know, some of the most
yes,
philanthropic individuals are religious individuals. And so sharing that message of we are about improving the way we do missions through the use of research and data as our tools.
Okay.
Um, and what
So
we know is,
so
yeah,
let me ask you. So you help your partner. You help them raise money as a
our partner
question.
organizations
Yes.
with for the research.
You help them raise money. Help them with
Yeah.
their governance. So you're sort of a support organization for everything that they do.
We don't get into the governance yet, other than how they use the research
Okay.
that we help them generate. And helping them create practice pieces or white papers that interpret the evidence to ways that they can improve their programming. The funding piece, yes. And so we have a place on our website called the Marketplace. And the Marketplace allows organizations to put projects that we're working with them on. And so individual donors can go on and see the Marketplace and be like, you know what? I really love that project of mental health in Zambia and Malawi. I'm going to support that project. And so it puts the donor, principal one, as the driver of what it is that we want to do as far
You
as our ministry is concerned.
and this has been successful. You get hits on this. People will
We
respond.
started it about maybe 4 months ago, and it's starting to generate some hits as people know about it. When we first started it, people just didn't know about it. So we continue to put projects up there. And now, as we move toward the end of the year, that's going to be our major push for end of year giving in terms of getting this out there. So it gives individuals an opportunity to see specifically what projects they'd like to do.
Well, how do you get the word out for Meros itself?
Platforms like this, which is
Okay.
great.
I didn't. That was not supposed to be a trick question, but okay, fine.
And social media through our organizations as well. So as we publish papers with our organizations, they can also um, share that. So um, presentations. So conference presentations when we finish a project, right? So there's the Accord Network, and that's a pretty big network for us of organizations that are doing like-minded work in the space of Christian relief development and um, advocacy. The Accord Network, Christian Connections for International Health, is also a big network for us of getting connected with organizations that are in this space. Um, then ultimately through referrals and referrals of organizations that have worked with us and continue to connect us with other sister organizations.
Okay. All right. Now, do the member organizations do their own separate fundraising as well?
Mhm.
Okay.
Yeah.
Uh, any tension there or competition between your fund and theirs?
No. In fact, it's actually probably been synergistic in
Oh,
terms
okay.
of their
Good.
ability to better articulate their research. Like when they're filling out a grant application, we can help them with the language on how to measure. And of course, donors they like to see that. They like to see a
Oh, yeah.
well-articulated measurement and evaluation section. So it's very synergistic. We get to help them kind of with that language. And at the same time, they may be able to ask for more than what they were going to originally
Yeah.
request. And so it helps them, it helps us. And from what we've seen, it's just kind of enhanced both fundraising ability of both organizations.
Well, that's something I want to emphasize because many times um, associated or related organizations act as though they're dealing with a scarcity pie, that there's not
Yep.
enough. Okay. And that the more people that get introduced into it, the more ways you have to subdivide it. And,
Yep.
and my experience has been just just the opposite. And that is that there's a great deal of money out there that's untapped and it's always there. It's just a matter of engaging it. Is
Right.
and you're demonstrating that to me that
That's right.
it's not a zero sum affair. It actually raises awareness. It builds connections. It actually
Hmm.
makes the pie get bigger over time.
Hmm.
Um,
Yeah. Yeah. What we'd have to navigate, and part of it is just knowing the donor, knowing the foundation, knowing the family, and leading with the particular program with the research supporting it, or leading with the research and showing the implications for programming. kind of depending on where people like to fund. Um, so knowing that is helpful and guiding organizations. But then we're also thinking about as we build out our regional networks in Africa and Latin America and Southeast Asia, because research has to be also culturally sensitive. Um, so we work with local researchers in each of these regions, which gets at then local funding and local philanthropy in these regions and helping the organizations think about different ways of how to fund projects within their region. And that's something we're thinking about and growing into and want to learn more about how to do that well and support the organizations that way.
Um, in rough terms, what would be your sources of support? And what I mean by that is giving by individuals, giving by foundations, any kind of corporate support. Where would all that come from in general?
Yeah, so we got launched 3 years ago from two significant foundations that gave us a launch grant, and that's now ending this year. So we are,
So that's ending this year, is what you said. Okay.
mhm, yeah, and God willing, that some of that relationship will continue, with one of those family foundations. Um, but now we're shifting to having a stronger base of individual donors, of family donors, of foundations that like the research piece of things from a health mission side. Um, so, the Lilly Foundation is out there, some of these larger foundations that
Um,
fund church-based ministry and research. But then the corporate sponsorships, I think, is an interesting avenue to also include. A lot of businesses, global businesses, need healthy communities for a healthy
yeah.
workforce. And the church is everywhere. That's one thing about working to strengthen the local church is that they are in places where a lot of social services aren't. And so being
So
able to,
your individual support, that's what, more than half, less than half?
right now, it's probably about a quarter to a third.
Okay. And what are the other two thirds?
So then we have grants. We have grants,
Grants.
which
Okay.
right now is probably about half, but
Okay.
that's shifting to be more of a third. And then foundations. Foundations make up the other third.
Or,
We have
organ,
some,
organized foundations, not family
yeah.
foundations, correct? Okay.
Actually, right now they're mostly family foundations.
Well, see, family foundations in the philanthropic world are counted as individuals, Jason. And the reason why is because they and behave like an individual.
Mhm.
So I would
Yeah,
count
that makes
those,
sense.
if I were looking at it, I would count that as individual support. Uh,
Hmm.
and
Okay.
the other thing that you, as I think, would be more, especially you as being faith based, business owners, not corporate executives on a salary, but business owners tend to be, in any grouping, the most generous donors. And the
Mm.
reason why is that they have a commitment to the community in which they're in, because their
Yeah.
business is, they take their livelihood from the community. Is what they do.
Mhm.
So so when I look at giving, if a man or a woman makes a gift and they use it, they go through their business. If they're the owners, it's a gift from them. They're simply using the business as a conduit. That's all
Hmm.
they're doing. And in that case, it becomes 100% write off.
Yeah.
Because if they were giving it strictly as an individual and not as a disbursement from a company they own, then it becomes an individual gift and it's subject to those rules, which are more
Right.
restrictive. But they get more
Mhm.
bang for their buck if they can give it through their company, if they
Mhm.
have an ownership position in the company. And the same thing with foundations. If it's a family foundation, that's a series of individuals,
Yeah.
and so yeah.
Mhm.
And then you get a little bit of, you said, corporate support for specific research projects, correct?
Mhm. Yeah. Maybe not. Well, the corporate is still coming, but more or less individual for those specific projects through the marketplace. And then we also get a little bit in tuition. So we have a certificate in community health ministry.
Oh, okay. All right.
So
That's
the training piece offers some other opportunity for revenue.
We talked about that earlier, but we kind of got away from
Mhm.
that. Tell me a little bit more about that.
Yeah, no, it's just another part of this pathway and going from research to practice is lead, having the research lead into training opportunities. So what does it look like based on the evidence to have a community health ministry? What do we know about principles of community engagement? Like the resilience study, looking at mental health ministry, friendship ministry, like using the evidence to inform how we train practitioners in community health ministry. So we have that certificate now. We're also developing a training on research methods for organization leaders, just so we can have better partners in the field that understand the research language, understand the need for research, and the desire to be a good partner. Um, so we've got a few. 2025 is going to be probably a year of growing our training programs and platforms. It's all online just to be
Oh,
globally
okay.
accessible. We the Community Health Ministry certificate has so far brought in about 60 people from 7 different countries, including pastors, organization staff, university professors, all learning together, which is part of this global community idea that it's going to take a global community growing and learning together to really inform change. And so it's been really neat to see different professionals coming together in this space, studying what it means to connect the spiritual and the physical, faith and health in practice.
Wow. See, this is one of those things I knew nothing about. I didn't know this was even out there. I mean, you kind of know instinctively, especially if you're a person of faith, that there's a relationship between these two. Um, but I think this is really cool because you're showing a direct interface from science and spirituality. The two things really fit together. And I just find that fascinating. I really do.
Yeah,
And I think, well, and, the doctors who are really working with their patients know that the spiritual element does have an impact. It's not just
yeah,
reaching for the pill every time or whatever.
yeah,
Um,
yeah.
so, where do you want to go in this thing? What would you like to see it do?
I want to see us get to a point where we are generating localized evidence that that we can then do research on the research, right? So that's this idea of an impact network
Okay.
where we have organizations working together. We get to make the connections. We get to help with the three gaps: the gap of funding, the gap of research knowledge, and the gap of time to analyze and disseminate. You mentioned the statistics before.
Yeah.
Doing the analysis and getting it disseminated, is a big gap. And without dissemination, it really doesn't exist, unfortunately. Even if the data is collected, if it's not analyzed and disseminated, it might as well not have been done. And so getting to a point where all that is running in a system regionally, and then we can, as the impact network, really start to find themes emerging across cultures and across health themes when it comes to unpacking. I like the example I gave before. Church attendance leads to a 30% reduction in premature mortality. What's the mechanism there? What is happening? And is it the same among all religious denominations? Is there a difference? What are roles of some of these core concepts of prayer, of forgiveness, of grace, of purpose and meaning? We know that influences how people interact and relate. It influences stress. Um, so that's what we get. Hopefully, we get to that point where we can start to see these themes emerge and we can develop new tools and strategies um, for supporting organizations and ultimately for strengthening the church.
Okay. Well, wow. I'm still trying to soak all this in. So then so let me put a time frame on this. Where do you want to be in 5 years?
5 years, we want to have each of our three, if not four, regional networks up and running with local teams so that there are local researchers, there's a research director at each of the centers. Right now, I think we're calling them centers of excellence in Christian health
Yeah.
ministry. So Meros Africa, Meros Latin America, Meros Southeast Asia, Meros South Asia. and really develop the core teams in each of those areas. So there's local teams running the centers, creating those collaborations and connections between organizations and research teams.
Okay. All right. Is there anything that I've not talked about that you would like to offer?
I think, when it comes to research, it's easy to just think about either the lab and bench science or the academy, and that it's useful but not necessary.
Hmm.
And I just want to put it out there that this isn't the spare tire in your car. This is ministry. Research is ministry. It's it's part of our responsibility to be good stewards of the lives and the resources we have, and to be the best storytellers we can be of the people we're serving.
Yes.
And without stepping back and testing our assumptions, we end up, I think what you mentioned earlier, we get stuck in a groove. We get stuck in doing just what we've done. And I believe research is one of those objective tools that we can use to help each other step outside of that groove, really clarify what we're assuming about a particular program or area of work, especially the integration of faith and health, test it, and move forward collaboratively curious to inform hope-filled dignity among those that we're serving in a more holistic way. So I just want to leave with that, like that research is ministry. At every step of the process, we're building relationships with the research team, relationships with the organization staff, with each other, relationships with students, relationships with community members.
Okay.
So,
Wow. Research as ministry. I like that very, very much. If someone wanted to take a look at your work, where would they go, Jason?
meroscenter.org, MEROS center.org. Can also email me at jason@meroscenter.org as well.
Okay. All right. Okay. So this has been a pleasure. I must admit I didn't even know this existed, and we got to know each other through a common friend. It's amazing how these things happen. So yeah, I want to thank you for taking your time to do this very, very much.
Thank you so much for having me, Larry. It was a pleasure talking with you.
Everyone, I've been sort of blown away here trying to keep up with this guy and thinking, there's some really smart people out there and they're doing some really innovative things, as the English say. And so that when you understand that faith has direct impact on your health or fostering good health, and the two work together, and that it can be quantified and it can be measured, which I think is even more pretty amazing. So I want to thank Jason for coming with us today and allowing me to talk with him. Soon we'll have somebody else here that will, I think, probably teach me something I don't know.